health session. And my name is Jiwan, and I work at UCLA, and I'm the moderator for this session. So my colleague Jillian is also here to help. We're supposed to have three, more speakers here to give us 3 talks, but currently we have 2. We have speakers for the 2 talks. So for now, we will have 2 talks for today's session. So each presentation is around 15 minutes, and we will give time for questions at the end of this public health session. There's a Q&A window. If you look at the bottom of the screen, feel free to ask the questions in that window, and we will ask the speakers to answer the questions. Welcome the speakers from UC San Diego. They're gonna talk about a topic. They're gonna talk about visualizing preterm birth in Bay Area. So the speakers are Dr. Yang. He's a geospatial research scientist and developer at Qualcomm Institute, UC San Diego, and also Dr. Jen Koska. She's an assistant research scientist and geospatial GIS specialist at Qualcomm Institute, UC San Diego. So let's welcome our speakers. I will leave time to you two. Jay and Martha, you can share your screen.
Okay.
Yes, feel free to share your screen. It will replace my slide with yours.
All right, sounds good.
Our presenters from UC Merced are here. I'm currently working on the technical side to get them ready, but let's start with, there we go. Excellent.
Okay. And you guys can see my main presentation, right? Not the presenter view?
That's correct.
Okay, great. All right. Hi, my name is Marta Jankowska. I am here today with Jay Yang. One of our partners in this project, Jessica Block, couldn't make it today, but we're going to be presenting some of the work we've been doing with the UCSF Preterm Birth Initiative and discuss how we have tackled visualizing their data and associated risk factors. Today we're going to be focusing on the Bay Area, but this project has spanned a couple other geographical regions as well. So the UCSF California Preterm Birth Initiative is a project that started a couple of years ago, and the mission is to eliminate racial disparities in preterm birth and to improve health outcomes for babies born too soon. And a lot of people are not aware that preterm birth is actually quite a big public health issue, specifically in California, but throughout the United States. So 1 in 12 babies in California are born prematurely, and this can lead to all kinds of different complications in health. It can lead to everything from delayed learning and delayed milestones to problems with respiratory issues and problems with lung development, and in some cases can even lead to death. So it is a really big problem that has long-term health impacts. The really tough part to swallow about this problem is that there's a huge racial and ethnic disparity in preterm birth. So Black women are 47% more likely to give birth prematurely. And this is a disparity that the California Preterm Birth Initiative is really looking to try to solve. So where our team comes in from UC San Diego and the Health Data at Scale Collaboratory, we were approached by UCSF to help them take a bunch of the data that they had and link it back to various environmental, demographic, and socioeconomic factors. So we wanted to provide some kind of public platform that would make it easy for people to visualize the data and navigate the data, and something that was accessible to both non-researchers and interested members of the public. Preterm birth is a really complex issue. There's several factors that come into play when we talk about preterm birth, and it's not just genetic, it's not just the health of the mother, it's not just the environmental exposures. All of these things work in tandem to result in potential prematurity. So while we know a lot about these individual factors on their own, we really don't know much about how these factors interact and how various environmental and contextual exposures come together to, in a way, compound the risk that a mother may experience from having several of these factors at once. So, and the other thing is there could be environmental and contextual factors that we don't even know about that are related to preterm birth. And that particularly is a spatial problem, because what might be affecting preterm birth in one area may not be affecting it in another. So certain pesticides or certain exposures may only be occurring in certain places. So why data exploration and why data visualization? So exploratory spatial data analysis really has been a field that's been around for a long time. And the whole goal here is to utilize geographic linkages to allow people to explore spatial patterns, to compare rates in one area with rates in a nearby area, to really look at different clustering patterns, and also to really help generate hypotheses. So questions such as where and when do healthy and unhealthy exposures occur that are linked to preterm birth, how much of a certain exposure is needed before it actually impacts preterm birth, and what are the different patterns we might be observing. And again, with such a complex issue as preterm birth, having a lot of different environmental factors to look at once could really help researchers better understand and generate hypotheses about this problem. Oops. So sorry about that. The tool that we ended up developing, and Jay, my co-presenter here, is going to show you guys around that in a minute. The tool that we developed was a really iterative process, and it took a lot of meetings, a lot of trials, a lot of errors. It turns out it's really challenging to generate a data visualization tool that actually gives you good, informative, and deep data to dig your teeth into, but is also accessible to public members and stakeholders. So we went through several meetings with stakeholders in Fresno and San Francisco, Oakland. Those are the two sites where our tools are focused, because these are two areas that have the highest rate of preterm birth in California. We went through several meetings. We did a bunch of iterations on the website. We also had a bunch of focus groups on what topics to include on the website. So you'll see soon we have a number of different data topics, and these weren't just chosen arbitrarily. They really were chosen through community member and stakeholder feedback. And when I say stakeholder, I mean people that work at hospitals, I mean NGOs, people who actively are working with mothers, gynecologists, etc. And then once the site was up and running, we had several workshops that we did with members of the community, both in Fresno and Oakland, both to teach people how to use the site, but also to get feedback on the site. So the result of this research has been 4 kind of key products. The first 2 are the Fresno and the Bay Area data visualization portals. The third is actually an open and available source code for the websites. So it's not going to be specifically the website, but it'll be pieces of code that you can use to generate very similar visualizations with your own data. If you want to build your own site on a different topic or even the same topic, that's all available on GitHub. And then we wrote a paper that was published in the CDC journal, Preventing Chronic Disease, about this whole process, about how the stakeholder work went, and then about the website itself and what it includes. So the data that we use for the site, and again, Jay will go a little more in depth into this, the kind of crown jewel of the data is this OSHPD birth cohort and hospitalization data. So this is a California agency that basically every time a birth happens in a hospital, but even sometimes not in a hospital, every time a birth happens, it gets reported. And so there's this mass data set of births going years back, and 2011 is not the earliest possible year, of births, and then information about that birth, whether the child was born prematurely, any issues that the child had. And then those data are linked to mother hospitalization records. So if the mother was hospitalized previously with issues such as hypertension, we have that information as well. And then we've pulled in a ton of other data sources. So things like the Cal Bioscreen from the EPA, a bunch of Census and American Community Survey data, several local and national data sets, things like walkability, crime, access to fresh foods, These are all different types of indicators that we've tried to include in the tool. All right, so I believe I'm going to now turn it over to Jay, and he's going to give us a tour of the tool.
Okay, so jump right into the data exploration platform that we developed for the Bay Area and San Francisco area. You can start from looking at the introduction video that talks about, because this is a collaboration between the UCSF Preterm Burst Initiative and us at UC San Diego. So you can look at the introduction video to understand the mission and the goal of the Preterm Burst Initiative. By looking into more details, connects to their website as well. And as Marta mentioned, our goal is to really curate the data into topics that we believe, and throughout discussion with community members and domain expertise, to create separate different topics that helps user to start by exploring data, and then maybe cook up a hypothesis for NGOs or for researcher to look into preterm bursts in different domains. So you will see the explore topics brings you to 9 different topics, ranging from burst data, demographics, environmental data, pollutions, all the way to indexes created by other research groups as well. And on the website, you will always be able to look at the frequently asked questions that we collected throughout the workshops, and by feedback sending for people that these might be useful information that to help you navigate to the websites. There's always the feedback option. If you see anything that triggers your eureka moment, you want to use the data, you want to understand or even collaborate with us, you can send us feedback and we'll get right back to that. So let's look into some of the topics as an example. Let's look into the burst data. Every time you click on a topic, the data source that you will be seeing prompts to you in this pop-up box, so you know that you'll be looking at data from the OSHPOT cohort and the other data set that is within this topic tab. You know that. And for each different topics, we develop different visualization component that is better supporting the exploration on these topics. For example, we want to look at percent of preterm bursts in each of the regions. And we want to compare to subtype, let's say percent of spontaneous preterm bursts, each of the regions. So you have a map and chart side-by-side comparisons. You hover over the South San Francisco area. This is by zip code. You see the 94134 zip code has 8.76% of preterm bursts under 37 weeks. And you can also see where this zip code ranks among us by the percent of spontaneous preterm bursts in the region. As you move over to different region, explore different zip codes, the bar also changes location. And it works the other way too. If you want to look at the highest area with the percent of spontaneous preterm bursts, you'll be able to see the maps will kind of pan to the area of your interest. And preterm bursts has different stages by weeks categorization. So this is one way to look at the burst count by different weeks or percent of preterm bursts in each of the weeks intervals. And every time you see these little boxes, the visualization component can be filtered. If you want to look at only underneath 32 weeks, let's say the highest region, 94621, and we have no idea where is that, so just click on that and the map will pan to South Oakland, around the Oakland airport area. This is, we think that using these visualization component better supports exploring preterm bursts on the burst data sites. And if you want to look back again to the data source, you can click on the data source, it will prompt you again. If you're interested in download the data, you can click on the download PDBI data and it will bring you to our shared drive and you will be able to download data and use it as you want. The select topic bar, you can jump to different topics we mentioned. There are some topics we're still working on it as new data coming in. Every year we receive new burst cohort data, and we constantly get new data from collaborators that use the site and see that, well, I do have that data set that I want to you guys to put it on there. It might be interesting. So we're constantly updating this data. For example, on the demographic tab, you were prompted with the data source again. The sidebar disappears by itself, not to distract you. And for different topics, we design different type of visualization to support better understanding in that data sets. Once again, we select percent of preterm births under 37 weeks, and you'll be able to compare women giving preterm births and women giving term births, different subcategories based on ethnicity, age group, education, and place of birth. If you again look at the South San Francisco area, the data will update on the right-hand side, so you can compare things side by side. So you'll be able to filter if you want to only compare, let's say, education under 12 years and over 12 years. And you'll see the same style side-by-side comparison. We use that throughout for different visualization. Comparing the preterm birth rate and environmental indicator, let's say walkability, as Marta mentioned. So you'll be able to see this side by side on the lower right-hand side information box. You can navigate through different regions and compare, explore the indicator that interests you and with the preterm birth data. So let's go back to the home page. One example of our collaborators interested in housing insecurity, as Marta mentioned, this preterm birth is really a racial disparity behind that in certain regions. So one example of using the data is to create a story map. So we take some of the subset of the data and create a story map of preterm births and housing insecurity to really dive into this narrative and understand whether the driven force behind that or the details in housing insecurity and preterm births. So this story map is created purely using the data that we have, but you will be able to use the data and then create your own visualization as you want to tell the story about certain dimension or aspect of preterm births, because this is really still very puzzling to the researcher. There are so many factors in play. I think the different groups and user will find their way of how to use our data to create visualizations and tell the story that they're interested in. So not only for this is for the San Francisco and Fresno, and this is for San Francisco and Bay Area, and the same size, similar site. We also built a similar site for the Fresno County using slightly different design, but the same idea behind that. And you will see you'll be able to explore different topics and also download the data as you need. So with this, we're showing that this visualization platform is really scalable. You can quickly replicate to different regions as we move on to different study region to understand the impact of environmental factors and demographic factors and how does that fare with preterm births in different regions. So we do see a potential of different researchers in different area and policymakers that we can engage with them and utilize our concept and to help them define preterm births in different regions. And as we do share the codes on the GitHub for the visualization component, so you to build your own similar style data visualization platform with detailed examples on how we actually do it in this way, so you'll be able to do the same for you. And as the FAQ mentioned, that if you want to know more about how to use the site on our YouTube channel of the Health Data at Scale Collaboratory, there are videos that are recorded to help user navigate through the websites and then make the max out of using the websites. I want to end with the dissemination on the website and this whole collaborations. As Marta mentioned, we already host a couple of workshops and also events to talk with community members and engage with them and get feedbacks from the user, how we can improve the site and how they can use the data in the site to.
Hey, hello, Jay. I'm sorry to interrupt. Now we see your your presentation slide. It's a node site. We can see your node here. Can you share another? You want to share another one?
Swap that.
Yes.
Maybe this. As Marta mentioned, that we already host a couple of workshops at Fresno County, at Oakland, and with San Francisco group to actually get the feedbacks from the community and the stakeholders and how engage with them to actually use the site and get feedback and know where we can improve. And I'm very interested in the whole process on how we build this collaboration with the community. The paper is published in the CDC Journal of Preventing Chronic Disease. And also it's being reported in Fresno B. This is pretty much our talk. I'll hand back to Marta.
Yes, so thank you for your talk. I think we have a question from the chat window. I know from Colleen, she couldn't tap in the answers to the Q&A, so I want to mention the question quickly in case we can't see it as we have more chats here. So are there plans to expand beyond the Bay Area? Have you found OpenStreetMap preferable to Esri products? Have you found associations between environment, ethnicity, and other social economic factors?
So as you guys saw, we did do the site for Fresno. We may be doing a version for San Diego. For now, those are the three main local areas we're planning on. I think it is important with something as complicated as preterm birth. I mean, yes, you can look at California wide, but I think you get a lot more information and context when you really focus in on a specific region. So for now, those are our plans to stick locally. Who knows, maybe if someone wants to throw money at us, we'd love to build one for California, but that's always an issue. And in terms of associations, yes, we are actually working on pulling in these different data sources to try to create some more complicated or just more complex modeling frameworks. So ones that actually go at both environmental, individual, and genetic levels. And there's been quite a few papers. If you just go to the UCSF Preterm Birth site, they have a list of their publications. Some of them are by us as well, and there's just a wealth of information there. I'll let Jay answer the question about OpenStreetMap versus Esri.
Yeah, I think we started with the mind of using open source development because we do want to this site to be available for a lot of users to build their own visualizations. I think we start with B-flat and open source libraries mainly focus. The story map is just one example that how user can use the data to build their own storytelling application. So yes, OpenStreetMap, Esri map, Bing map, whatever map you have access to doesn't really, it won't change what the visualization that you're trying to achieve. So I think both works. And I do find open source library very easy to use. And for the questions about GitHub link and story map, we will post that in the chat.
Okay, thank you, Jay, and awesome. So we will save other questions at the end of this session. So feel free to tap the question to the Q&A window. So next, we will welcome the speakers for the next talk. So Ariana and Fernando. Fernando comes from UC Merced, and he's a undergrad majoring in let me check, sorry. Majoring in environmental engineering, and they will talk about the risk assessment and geospatial analysis for SARS-CoV-2 in wastewater. So let's welcome Ariana and Fernando. So leave time to you guys. Can you share your screen with us?
Yes. Okay, I hope that's working.
Yes. Looks good.
Good afternoon, everyone. My name is Fernando Roman, and I'd like to thank everyone for attending our presentation. I would also like to thank the organizers and other presenters for making UC's GIS Week possible. My research partner, Ariana, Tariki, and I are both fourth-year environmental engineering majors at the University of California, Merced. Throughout the semester, we have been studying SARS-CoV-2 behavior in wastewater, wastewater-based epidemiology, and wastewater treatment plants as a part of a UC Center-awarded COVID-19 emergency seed grant research team led by Assistant Professor Colleen Auden at UC Merced. Our research is funded by CITRIS, the Center for Information Technology Research in the Interest of Society. Next slide, please. Our presentation will go over a brief history of wastewater-based epidemiology and how it is being used to help combat SARS-CoV-2. We will also showcase UC Merced's global SARS-CoV-2 wastewater monitoring efforts dashboard and our research involving wastewater treatment plants and disadvantaged communities within California. Next slide, please. This presentation would not have been possible without the help of our research team. Our research is a collaborative effort coordinated by UC Merced and UC Davis. Our team consists of Assistant Professor Dr. Naughton from UC Merced, Assistant Professor Dr. Kanyua from UC Davis, Graduate Student Yihan from UC Davis, Graduate Student Ana Grace from UC Merced, along with Ariana Tariki, Matt Deeming, and I pictured on the bottom right, the three of us being environmental engineering undergraduates at UC Merced. Next slide, please. Wastewater-based epidemiology, also known as sewage surveillance, monitors levels of targeted biomarkers and chemicals within wastewater to analyze threats within a population. It has historically been used as a tool to monitor illicit drugs along with pathogens such as poliovirus. Recently, wastewater-based epidemiology has gathered a lot of attention since it can be utilized to monitor levels of SARS-CoV-2 within municipalities. Up to over 50% of people, both symptomatic and asymptomatic, shed SARS-CoV-2 in their feces. Scientists and engineers can detect the RNA of SARS-CoV-2 that infected people have shed by sampling wastewater, and those samples can show trends of SARS-CoV-2 levels within a population. Since infected individuals shed the virus as an early symptom, groups analyzing wastewater can help predict outbreaks of SARS-CoV-2 2 to 14 days prior to them actually happening, allowing local authorities to help stop the spread of the virus. While wastewater-based epidemiology is not meant to replace individual testing, it works well alongside clinical trials and can sample a large pool for relatively low cost. Next slide, please. Many universities and public authorities around the world are using sewage surveillance to guide local policies on COVID protective measures. Utah's Department of Environmental Quality has a very in-depth sewage surveillance system and monitors many wastewater treatment plants and sewage sample sites around the state. Another great example is the University of Arizona, who, through testing the dorm's wastewater, were able to find and isolate 2 asymptomatic students who had the virus. Inspired by the Johns Hopkins coronavirus dashboard, and inspired by wastewater-based epidemiology, our research team at UC Merced sought to create a dashboard showcasing global SARS-CoV-2 wastewater monitoring efforts. Next slide, please. Utilizing Esri's ArcGIS online dashboard tool, we were able to create and share a dashboard which visually summarizes global SARS-CoV-2 wastewater monitoring efforts. Anyone can view the dashboard and see universities, countries, and sample points for locations using wastewater-based epidemiology. By zoning in on an area in the dashboard, California, for example, one could see that many universities are now testing the wastewater. Universities we know, like UC San Diego, UC Irvine, UC Santa Barbara, UC Merced, UC Berkeley, and UC Davis. We also added links to news articles, dashboards with wastewater data, and publications for many of our points. Next slide, please. We are required to continuously update our map. To find new points, we are constantly monitoring Slacks, the COVID-19 wastewater-based epidemiology collaborative, attending webinars, searching keywords on Twitter, conducting internet searches, reading publications, and reviewing request forms from institutions that would like to be added. Our Twitter account, @COVIDPoops19, is also tagged on a lot of Twitter posts, and with a growing number of followers, we've been able to share our map to academics, water enthusiasts, and the general public alike. Now I'd like to pass it on to Ariana, who will talk about another aspect of our research, wastewater treatment plants in California.
All right, hello. So I'm really excited to be presenting to all of you today at UC GIS Week. As Fernando already mentioned, my name is Ariana Tariki, and I'm a 4th-year undergraduate at UC Merced. And today I'd like to present to you our research on wastewater treatment plants in California and their proximities to residential and commercial areas using GIS principles. So while the potential of SARS-CoV-2 spreading through fecal, oral, and aerosol-borne transmission is still being debated, we've been researching wastewater treatment plants in California and their proximity to nearby neighborhoods to see if there's a potential risk for aerosol-borne transmission. During the early stages of wastewater treatment, this research is also beneficial for understanding potential risk of other pathogens and wastewater treatment plant proximity to our workplaces and homes. So in order to conduct our research, we first needed to know the number of wastewater treatment plants in California and their locations. We started by combining 2 public data sets, the first being the Environmental Protection Agency's Facility Registry Service, pictured as the smaller map on the bottom left. The second source was Cal EPA's State Water Resource Control Board's Facility at a Glance webpage. And we were able to look through most of their listed locations and find wastewater treatment plants in California. From here, we looked up location addresses on Google Maps and noticed that latitude and longitude points weren't right on top of treatment plants. And for our research, it was imperative that we had the locations in the right areas. So the 300 wastewater treatment plants were split among researchers in our group and searched in Google Maps and given longitude and latitude points that corresponded to the middle of the plants. We also conducted measurements within Google Maps to find the wastewater treatment plants that are 250 meters away from residential or commercial areas. 250 meters was used as a base measurement since we found that in California there are no regulations for the distances that wastewater treatment plants must be in relation to communities. This is unlike some other countries and even some other states in the US who do have published regulations. Studies have found that communities nearby wastewater treatment plants may be prone to adverse health effects such as headaches, respiratory issues, tiredness, difficulty concentrating, and skin diseases. Even if SARS-CoV-2 cannot be spread efficiently through bioaerosols, it's still important research to understand for the potential of other pathogens spread from wastewater treatment plants during early stage treatment and how they can potentially affect nearby communities. Many wastewater treatment plants in California are less than 250 meters away and from residential areas and were built there prior to modern environmental regulation laws. And this is why we decided to research a 250 meter proximity from wastewater treatment plants. So we uploaded our total Excel onto ArcGIS to get our visual map of wastewater treatment plants in California, which is what you see on the right of the screen. And we managed to find a total of 305 wastewater treatment plants. Okay, so the next part of our research is mapping wastewater treatment plants in vulnerable communities. To do this, we use the CalEnviro screen version 3.0. The map is displayed here with the darker orange and red areas being disadvantaged communities. So what is a disadvantaged community? Well, a brief definition is a California defined area that suffers a combination of economic, environmental, and health burdens. Also pictured is from the report on the CalEnviro screen are the different attributes listed within this data set. These can be pollution burden, population characteristics, environmental effects, and socioeconomic factors, and all the characteristics within them that you see in the picture. Scores are calculated, and areas with high amounts of burden are the top 25% of the calculated CalEnviro score. This data set and report can be found on OEHHA's website on behalf of Cal EPA. So in ArcGIS Pro, we then calculated the intersections of wastewater treatment plants in disadvantaged communities of the 37 wastewater treatment plants in the Bay Area, pictured here on the slide. So from these statistics, we found that 84% of wastewater treatment plants are less than 250 meters away from residential or business areas. We found that of these wastewater treatment plants, 38% were in disadvantaged communities. And of the 14 that are in disadvantaged communities, 12 of them were less than 250 meters away from residential or commercial areas. And these results are preliminary, so we're still working on expanding it to all of California. So some next steps for ongoing and future work, we're going to use ArcGIS Pro to buffer 250 meters away from each wastewater treatment plant in California. By using either land use data or zoning data, we can see where buffers intersect with commercial or residential areas. And you can kind of see that in the picture here in the middle. This will give us a better automated system to find proximities of wastewater treatment plants to communities. Once we can automate these results, we'll do the same analysis, but with buffering 500 meters away, following some other literature of other countries' regulations. Other steps we're currently working towards is mapping areas where sanitary sewer overflow incidents occur. This can give us an idea of areas that are more vulnerable because sanitary sewer overflows can be caused by different things such as blockages, sewer defects, power failures, or improper sewer designs. These can potentially threaten or may threaten communities' public health because of potential contamination from sanitary sewage. Another step to our plan is to follow the similar methodology explained before to find wastewater treatment percentages in urban and rural areas to see if there's any statistical significance of these differing locations. Yeah, so that kind of concludes our presentation. We would like to acknowledge UC GIS Week for putting on this amazing event, and of course, researchers at UC Merced and UC Davis. This work would not be possible without them. Thank you to Citrus for funding our research, and to wastewater workers. Thank you to frontline workers and everyone who's been sampling to make our research possible. And thank you to the COVID-19 wastewater-based epidemiology collaborative. So these are references, and yeah, so if you have any questions, we'd love to answer them, and please feel free to follow our Twitter at COVID Poops, and friendly reminder to only flush the 3 Ps, and thank you.
And thank you, Ariana and Fernando. It's really interesting name, COVID Poops.
Thank you.
It's so funny.
Yeah, there's been comments that we
and
love.
we will save the questions at the end of. Do you want to say something?
All right, thank you so much.
Yes, so we will save the questions as end of the session. So feel free to tap in the questions to a Q&A window. So next we welcome our last speaker, Debbie. Debbie is a data scientist from UC San Francisco's Department of Epidemiology and Biostatistics, and she will talk about mapping healthy inequities. So let's welcome Debbie. We can't hear you.
Yeah, sorry, there's too many windows here. So now you can hear me, right? Okay,
Yes.
Let me share my screen again. Okay. All right, how does that look? Does that work?
Yes, it looks good.
Okay, great. So hi, everyone. It's great to be able to share with you some of the work that we've been doing in mapping health inequities. So today I'm going to be sharing 2 of the projects that we've been working on over the past year or so. My name is Debbie O, and I'm from UCSF, the Department of Epidemiology and Biostatistics. My background is in epidemiology. My title is data scientist, but I think I kind of fall somewhere in between. I also have a background in graphic design, so I'm kind of able to integrate that all into the work that we do in mapping. Okay, so we all know now more acutely than ever that when it comes to health, place matters. So the COVID pandemic has made that really absolutely clear. Some populations are clearly disproportionately affected. The recent wildfires in California has also made this really painfully obvious. You know, if you were constantly refreshing purple air during the wildfires like me, you know that where you live affects your health, and it affects the way that you can live and the way that you can keep yourself healthy. So about a year ago, we decided we wanted to make a tool that researchers could use to better understand factors influencing health at a population level. So we wanted something for researchers to be able to use for like grant writing or study planning, hypothesis generation. So while the focus was supposed to be for researchers, we understood, or we still understand, that research alone cannot make public health progress. So we hope to create something that could also be used by policymakers, community advocates, and public health professionals, so that they could, take this tool and make data-informed decisions in their work. So what we created was an interactive map of over 100 variables to explore neighborhood level characteristics. We spent most of last summer kind of thinking about the vision, and we officially kicked off the project in October 2019, so about a year ago. We were planning to wrap up development in March and then launch in early April. But as you all know, the COVID pandemic kind of upended things. And so we were planning to just kind of initially release this map with these neighborhood level variables. But at the very end, we were asked to add COVID data onto the map. And so we connected with the Los Angeles Times, who has been collecting COVID data on a daily basis from the 61 different health departments in California. And so they have graciously shared their data, actually not just with us, but it's kind of open source. Everybody can access it on their GitHub. So we have COVID case and death data from LA Times. Hospitalization data is from the California Department of Public Health. And a new addition as of just like less than a week ago, we also have COVID in nursing facilities and COVID in prisons. And that's also from the LA Times. So we collected data, in addition to, that COVID stuff, we collected data from many different data sources. I think it's like close to 20, loosely based on a social determinants of health framework. So we categorized it into demographic, socioeconomic, community, neighborhood, and health and healthcare. In our map, we kind of kept the COVID data separate just to make it easier to find. And you'll kind of see the maps in a little bit. So here's the list of the different places that we grab data from, and you may recognize them since it seems like some of the other people presenting today also use kind of similar sources, and these are really rich, resources that anybody can and should use to inform their work. I would say that of the list, the ones that are in bold were the ones that we used most. So American Community Survey, Los Angeles Times, CDPH, and 500 cities. So in our maps, we have 3 different levels of geography. We have census tract, place, and county level. So county, county is something that most people can kind of wrap their minds around. Census tract, I would assume, or my guess would be that most people in the audience would understand census tracts, but just in case you've never heard of it, a census tract is a geography that the Census Bureau has kind of created that's supposed to contain around 4,000 people, or around 4,000 people live in that area. The places data was put together specifically to match the way various departments of public health have been reporting COVID data. So it's a little bit of a patchwork. So in San Francisco, it's zip code, but in Los Angeles, it's neighborhood. And, we kind of custom built it so that we could show COVID at a more granular level. Some of the other features are, and I'll walk you through these one by one. You can compare 2 variables, you can see data distributions, there's a custom area selection, you can export the data, and we have detailed data descriptions, and we also have data stories. So here's an example of what a comparison of 2 variables looks like in Health Atlas. Here we're looking at unemployed and uninsured. So darker blue indicates higher levels of unemployment. Darker yellow indicates higher levels of uninsurance. Darker green indicates higher levels of both. So I should note that for this map, it's 2 variables laid on top of each other. It's not filtered data. So when it's dark green, it doesn't mean those people in there are both unemployed and uninsured. It is just those 2 variables laid on top of each other. Okay, so just popping out the scatter plot a little bit. I just wanted to highlight the other visualizations besides the map. So on the left-hand side, you see a histogram, and that is for like the California state distribution. And then in the scatter plot, you can see also, again, the California state distribution. This one in particular is for census tracts. And so if you see a black dot on the map that you're interested in, if there's like an outlier, you can click on it, and then the map will kind of take you to that place. The scatter plot also serves as like a legend for the map, as well as the histograms. Okay, so we also have a custom selection feature, which I think is pretty useful, especially if you're interested in specific regions or neighborhoods. So say, for example, you're interested in looking at COVID data for the southeast part of San Francisco. So you can select kind of the 2 zip codes for that area and get custom data estimates for almost all variables. So this is just a screenshot. If there's extra time, I can do a demo, but I suspect there might not be. But if you can see that we have here COVID cases per 100,000 people, and then we have extremely low income households. You can see for that neighborhood that the case rate is actually higher than the state average. So the orange is for that neighborhood, and the blue is for California. And then below in the histogram, you see that little orange line, and that indicates where that neighborhood falls in the California distribution. Also in the scatter plot, you see that little orange dot, and you can see that, yeah, that neighborhood has relatively higher levels of extremely low income households, as well as relatively higher COVID cases per 100,000 people. So it's a lot of information kind of packed into one place. If you're interested in exploring more or appending the data to your own data, then you can export it. And I just wanted to highlight here that you can download data for a custom area. So while the map shows just the two, it actually will give you data for any other variable. Almost some of them, because they're indices or the denominators are kind of more challenging, not all variables will come at the neighborhood level or the custom area level, but almost all of them are available, and they are estimates. So they're population weighted estimates or household weighted estimates. Now, if you're interested in learning more, this is for maybe the researchers in the audience. You can click on the little eye, and then there's information about its significance, sources, and some references. This is maybe particularly helpful if you're like writing a grant or just like trying to understand how you can maybe use this data for your own work. And lastly, if you're interested in exploring one of our data stories, you can click on Explore Data Stories in the top right-hand corner. Currently, we have 6 stories. There's 2 on COVID, 1 on food insecurity, 1 on housing insecurity, 1 on Latinx ethnic enclaves, and then 1 that's like an introduction. So it's kind of like a tutorial on how to use our site. And just wanted to recognize that Health Atlas has been a collaborative effort. It was developed with support from the UCSF School of Medicine's Dean's Office of Population Health and Health Equity. We got expert guidance from some faculty at UCSF for our data stories. And we're also fortunate enough to have the creative and technical genius of Stamen Design, as well as writing expertise from Plain Language Health. Okay, so on to the second project. The second project I wanted to share with you is our California Health Maps tool. Just as a little background for this project, UCSF houses the Greater Bay Area Cancer Registry. And that, I mean, it's an incredible public resource. It's like the closest thing that we have to like Scandinavian health records in the US. Like every single cancer case is recorded, and there's information. And there's a lot of rules about how you can use it, but it's an incredible resource. Currently, however, the data is presented in a style that is in a format that like researchers and epidemiologists are very familiar with, but might not be as accessible to the general public. Also, generally speaking, the data is available at the county level as the smallest level of geography. However, we've felt an increased demand for sub-county data just to make it more meaningful for public health and policy efforts. So the goal of this project was to develop an interactive mapping tool of health data for geographies beyond the county level in California.
Hi, Debbie, I'm sorry to interrupt, but we have limited times. We only have 10 minutes left. So.
Sure, I'll just try to get I have like 7 more slides.
Sure. Okay, go ahead.
So we have 7 geographies. So zones were, let me just say that zones were built specifically for this type of visualization, specifically for cancer data, and we went through a whole process to make those. But there's also MSSAs, which is a California, a geography unique to California, but there's also all these different legislative district as well as county. You can see cancer incidents for 12 of the most common invasive cancer sites, and you can filter it. So this is different than Health Atlas in that you can filter by sex and race ethnicity. And there's also a lot of other data on demographics, other things that might be relevant to cancer outcomes. So let me just walk you through what it looks like. So here you can select your area type. You can search where you want for your location. You can choose either 5-year or 10-year cancer incidents. You can choose your cancer type, filter by sex or race ethnicity. So here I have chosen county and lung cancer. And if you look at Los Angeles, it looks like Los Angeles has pretty low rates. However, if you switch to zone, you can see that it is not uniform. And in a place like Los Angeles, which is really diverse and actually kind of really, really populous and geographically large, you would expect to see differences. Then I zoomed in here on Long Beach and kind of selected one of the zones. And oops, and you notice, excuse me, that the rates are higher. So it's actually more purple, so it's like a darker color. You notice Long Beach, like something, there are higher rates. There is higher rates of lung cancer in Long Beach. And you can, under the map, there's a little bit more detail. You can see that for that particular zone, it has a higher incidence rate of cancer compared to the state, 55 compared to 41. You can also download the data if you want. You can also download a map in case you want to put it into a grant or something. You can also print the page. So this might be useful if you're going to talk to like a community partner. You just have a printout and you go talk to people in Long Beach and say, hey, what's going on in terms of lung cancer? And what are some things that are happening in the community? What can we do to change things? So this is just a little close. I just zoomed in a little bit on the additional data that you can get. So there's demographics, healthcare access and use, health and well-being. And then lastly, at the very bottom is the Learn section, where you can get more detailed information about the project, methodology, FAQ, and definitions. So this work has been a collaboration with the National Cancer Institute, Westat, and a key player in this project was Green Info Network, who helped us build out the website. And it was so well received that they were actually asked to make it open source and available to other cancer registries. So that is available to others to use. However, the cancer registry data is usually owned by the individual registries. So it'd be more useful for people working within the cancer world. And I think that's it. There's maybe 7 minutes for Q&A for everybody. So thank you.
Yes. Thank you, Debbie. I think we have a question from the chat window. So Colin asked, does export include shift? So when you mentioned the layout, the tool, on the online tool, you can export data. So the question. Hello, Debbie, can you hear me?
Yeah, I couldn't understand what you said. You're a little cut off. I'm sorry.
So you show us the online tool, the first project. We can export data from the online map, right?
Right.
We can export data. So does the export include shape file or is only the attributes?
Oh, it's only the yeah. So it comes like a CSV file. It's not the shape file. But if you're interested, I mean, we're happy to share. It's the shape files. The only one that might be of interest might be places, but that's maybe it's very COVID specific.
Okay, I see. So we have another one. Do you have any improvements you'd like to make going forward? For example, do you want to put this on GitHub?
So we're talking about
the
both project or
the project. I think both the data or the online application, the tool, probably, from my understanding.
Okay, so both projects we are wrapping up actually around a development for this year. I know that moving forward, we will continue to update the cancer registry data. Health Atlas, we've been talking to various parties considering using it. I think, well, we are piloting it actually in an electronic health record right now. We're also considering using it maybe for other applications, either for community partners or for patient navigators. Right now, we're just wrapping up some things with like mobile improvements and smaller things. We added some new data layers and things like that. So there's a lot of ideas for the future, but we are currently focused on just like sort of finishing this round of development. But we are very open to new ideas and collaborations, and I would love to hear from you.
So is the first project the Health Atlas map on GitHub now?
That is not on GitHub, but if the COVID data is available through LA Times on GitHub.
Sure. I think we have another question for Ariana and Fernando. So the question was, how did you choose which pollution data from co-invar screen to 3 to use? And do you use all of it or choose one or few pollution factors? The question is for Adriana and Fernando.
Well, as aforementioned in the chat, we initially did it with all the factors, but we also mapped out lots of individual factors as well, and even combinations of some, trying to see any trends. One interesting thing we did was for disadvantaged communities, which represents 25%, the top 25% most, at-risk places. We recalculated that specifically for the Bay Area by deleting all the other counties and recalculating just the top 20, the new top 25 percentile for the Bay.
Okay. Okay, thank you.
I had one more question for hold on
for
one
answering
second.
the question.
Yeah, sorry.
So do we have any?
Gian, I have a question for Debbie in the chat. And it was, sorry if I missed it, but how are the zones determined in the California health maps?
Right, so I could probably do another 15 minutes just on how the zones were developed. So what we did is we used something called an AZ tool, and we put in percent minority, percent urban rural, and poverty, and tried to create these zones that were minimum population 50,000, maximum population 100,000. We put in all these factors, and we came up with a few versions of it, and then we tested it with the community. And so it was this whole process that we did in conjunction with the National Cancer Institute and Westat. I'm happy to connect more on that. I can't see where that question is from, but if you email me, I am happy to give you more information on how we created those zones.
Yes, I think you can ask question in our Slack channel. I think all of us are in our Slack channel, right? Julie just posted a chat window of our Slack channel. Join the channel and we can continue the conversation.
Yes, I'll repost that in just a moment. Join us on Slack to continue the conversation if you like. That includes our presenters as well.
Yes, so personally, I have a question for G and Marta. So when you display the preterm birth, I want to know the premer's data is about the hospital locations or the actual the patient's locations. So when you visualize that map, so do you get the data from hospitals, or it's about the actual location of the person?
It's the home location of the mother.
I see. I see. Okay, awesome. And also I want to know the right, but when you realize it, like in aggregated into the, for example, census tract or neighborhood level. I think
you're cut off a little bit. Can you repeat that question? Thank you.
So the data you have is this individual data, right?
Yes, the data is came in as individual level, but to able to analyze and show that it's aggregate to geographic areas.
Yeah, and also the IRB doesn't let us share individual data, so we have to aggregate it to, I think, N of 10 is the minimum amount of births.
Okay, okay. Thank you so much. Thank you for answering the question.
Thank you.
Okay, I think this is the end of, I think there's probably a cutoff of my voice. Right. Applause to our speakers. So although the sessions, but we invite you to continue the conversation in the Slack channel. It's 2020 Public Health. And also, thank you so much for attending, and thank you so much for our speakers. So let's meet in Slack. Thank you. Bye.
Thank you very much, all.
Thank you.